Hello class, this is Group 7's presentation on opioid use disorder among women. Our group consists of Pham, Alex Tran, Juan Guerra, and myself, Melissa Ramirez. Introduction. Opioid use disorder affects the brain tremendously. After repeated opioid use and continuous high doses, it causes brain damage. It's important to know that just like any other disease, opioid use disorder requires management in order to fix the problem. It's always said that this disease is very much stigmatized wrongly than other conditions and has always been seen and treated as an issue rather than a health concern. This also happens to be a prescripted drug use, which is growing fast and becoming a great problem in our nation. Almost 2.5 million people aged 12 and older have had an opioid use disorder in the past year in the United States. From this issue that all of opioid drugs are not legally obtained, an abundance of patients, majority women, have been legally prescribed this medication. Women suffer from chronic pain such as pregnancies, hormones, and menopause, which increase the rate and the risk of opioid use.
Hello everyone, my name is Crystal and I will be going over population for opiate use disorder among women. Our target population will focus on mainly women in the United States. Opioid use disorder affects all women regardless of their age, gender, and ethnicity. And according to Healthline, hospitalizations related to opioid pain relievers has increased by 75% in females compared to 55% in males due to many reasons. Women have been found to be at greater risk than men because it might be due to their differences in their pain tolerance and as well as their physical dimension. Women, of course, they do have smaller sizing, which is why they are more prone to being opioid addicted compared to men. Women who use opioid often have the following health-related issues, such as cramps, menstrual cycle, hormones, pregnancy, breastfeeding, and menopause. It's because pregnant women are more sensitive to the pain. Therefore, during labor and after labor, they would feel the most pain. That's why the doctor always prescribed them some strong opioid just so they could go through the whole process of giving birth. Even though they are in pain, but with the opioid, the pain will be relieved. Therefore, women think that the more they take, the less pain they get. However, that is another reason why women are more prone to getting the addiction. Women receive 2/3 of which 65% of all U.S. opioid prescriptions. And women in the age group of 40 to 59 years old received the greatest amount of opioid prescription because the older you get, the more chronic illness you have, therefore the more prescription you need. As compared to young women, their pain tolerance is a little bit more better than older women. Opioid use disorders rate are among certain minorities, including American Indians and African American. In terms of the health disparities, opioid addiction is different for women than men because women body sizing, which is the physiologies, are less resistant to opioid drugs than men. And that is also why women are quicker to become more physically dependent on drugs than men in general. With opiate use disorders, risk factors for misuse of these medications include a prior history of substance use disorder, certain demography features such as young age, older age, and for women who have more severe pain and co-occurring mental disorders, they are more likely to use opiate prescriptions.
Next slide, what is opioid use disorder? Opioid use disorder is a condition characterized by a harmful consequence of repeated opioid use, a problematic pattern of compulsive opioid use. Here are some ways to know if someone is wrongly using opioid drugs by demonstrating at least two of the following. Opioids taken in large amounts or longer period of time than intended. Craving or having urges to use the drug. Continued usage despite having recurrent social or interpersonal problems caused by the drug, giving up on social, occupational, and recreation activities caused by the drug, as well as unsuccessful efforts to cut down on their usage.
I will be going over impact on population for opiate use disorder among women. There are many factors that contribute to the rising rate of opiate use disorder. As previously mentioned, women are more likely to become dependent on opioid prescriptions than men, even from a smaller amount of substances in a shorter period of time due to their smaller physiology. Their sizings are, of course, smaller than men. That's the reason why they are more prone to get addicted to opioid prescription. Women who have experienced trauma, sexual harassment, or domestic abuse may also use opioid prescription to cope with their pain, and sometimes they find pleasure in taking it. Pregnant women also use opioids prescribed by their primary doctor to help with their pain because of their low tolerance for pain. Women in poverty are greatly impacted as well due to the lack of education and unstable living homes. Without any knowledge of what opioids is, it can really cause addiction. The impact of the health outcome upon the population is very important because the opiate users are more likely to have poor physical health and higher risk of mortality, like overdose or any other illness that is associated with opioid use. The rising incidence of neonatal abstinence syndrome is due to opioid use and misuse during pregnancy, especially for pregnancy women. Once in pain, they really don't know if they should consult with doctors or not. Therefore, the more they take, the more harmful and consequences for the baby will be. Opioid users tend to have a stronger desire of cravings for food due to that is one of the side effects of taking opioid. Continued opioid use despite ongoing physical or psychological problem likely to have been caused or worsened by opioids, and they also have problems fulfilling their commitment or duty for work and school. By being on opioid, it can really affect the way you think and the actions that you make, just because due to withdrawal symptoms and also other consequences like being late to school, late for work, just because the addiction can really make you feel very tired if you don't take it.
Population trend in opioid use general. In general population, opioid use disorder has been increasing in the United States for both male and females. According to Office on Women's Health, the prevalence of prescription among women by personal clinicians and other health professionals contribute to this significant spike of opioid use. From 1998 to 2015, prescribed opioid overdose in America has increased 471% among women compared to the increase of 218% among men. While this epidemic has been addressed in all different levels throughout health education, public intervention, there are still much needs to be done to reduce the prevalence of opioid addiction, mainly among women. Slide population trend on opioid use, different ethnic groups among women. Women become dependent on opioid pain medication quicker than men. Women tend to use the substance differently than men. They oftentimes use in small amounts for a shorter period of time before they become dependent on it, as well as they are more sensitive to this craving. Women most likely report different types of chronic pain than men do. Comparing different ethnic groups among women, the Centers of Disease Control and Prevention have noticed that white American and African American women have the highest rates on opioid use. This is because Black women live in large central metro areas, having the largest number of overdose deaths among women, while the same is true for white women in rural areas.
I will be talking about opiate use statistics. With opiate use statistics, estimately 450,000 people have died from opioid overdose from 1999 to 2018, including prescription opioid, heroin, and synthetic opioid. According to CDC, for every overdose death, there is about 119 emergency rooms and 22 treatment admission.
Hello, my name is Alex, and I will be going into specific detail on the mortality rate on opioid use. As mentioned previously in our population slide, women are more likely to become physically dependent on opioid medication. However, this correlation doesn't necessarily translate the same in terms of opioid overdose in the mortality rates in the US. According to the Kaiser Family Foundation in 2018, the overall mortality rate of opioid overdose among US women have actually decreased, while the male mortality rate increased by 6% ever since 2010. Additionally, many urban areas experience a slightly higher opioid overdose rates than those living in rural areas, and this is possibly due to a disparity in the accessibility to nearby hospitals or other health facilities for opioid prescriptions in urban areas versus the rural areas. According to the Kaiser Family Foundation, approximately 31% of the overall mortality rate by opioid overdose consisted of women in the US as of 2018, while men consists of 69%, which is the majority of the overall mortality rate. Although women in the US are more likely to develop a dependency on opioid use, men die from opioid overdose at a higher rate than women. According to the Kaiser Family Foundation in 2018, women in Wyoming has the highest mortality rate of opioid use at 55%, with the lowest female mortality rate in Washington, D.C. by 21%. This disparity between genders is a result of how each gender recognizes their conditions, and although research is limited, the findings of recent studies indicated that women are more likely to report their use of prescription opioids compared to men, which means that if they were to get addicted to these opioids, they are more likely to receive rehabilitative treatment sooner than men. In terms of the disparities based on race, it depends on the geography of where each case is located. For example, according to Hedegaard from the CDC in 2019, it's reported that Black Americans experience the largest percentage increases in the rates of drug overdoses involving any opioid or synthetic opioids in urban areas, with rates for deaths involving any opioids increasing by 103% and deaths involving synthetic opioids by 361%. While in rural areas, whites experience the largest increases of overdose deaths involving opioids and synthetic opioids as well. In terms of age, a majority of opioid overdoses occur in middle-aged adults ranging from 25 to 64 years old, regardless of gender, according to Lippold from the CDC in 2019. Now we will talk about how opioids affect the user and how it can affect normal social functioning. To summarize, opioids interact with opioid receptors in nerve cells in the brain and the nervous system to produce high levels of pleasurable effects to relieve pain and making them use more opioids often to replicate that sense of pleasure. The symptoms of opioid use include physical dependence and increasing tolerance, which causes them to desire more opioid prescriptions to achieve that same effect of pleasure, and most importantly, opioid-induced hyperalgesia, which is the paradoxical worsening of pain despite the aggressive opioid use from the prescriptions. And many of these characteristics can also be found in other forms of drug abuse as well. And as we mentioned in the introduction, these symptoms should never be stigmatized or should be looked down upon as moral inferiority. But instead, they should be treated and considered as a serious health issue in order to reduce the prevalence of opioid use amongst women. Moving on to the costs of opioid use in the US, because opioid addiction often results in slower behavior and other detrimental symptoms, it could have economic burdens from the lack of productivity from that individual and treatment plans to reduce the opioid prevalence in society. According to Mark, in 2000, it's estimated that the total economic cost of heroin addiction in 1996 was about $21.9 billion. And almost over half of that cost is the indirect costs of lost productivity due to heroin addiction or other opioid use disorders, including lost earnings due to premature mortality, unemployment, incarceration, and lower earnings. In terms of the US healthcare system, opioids are more prevalent and easily available today, in part because of the intense marketing campaigns by pharmaceutical companies, according to Carsarla in 2017. According to the 2014 National Survey, about 2 million Americans were dependent on or have abused prescription opioids as a result of abundant accessibility from their personal doctors. And on the right side of the PowerPoint, I have displayed a graphic about how much the US budget is allocated towards Medicare treatment. To summarize, approximately all Medicare costs made up 23% of the total economic costs in the US in the year 2000. Now adding more to the effects of opioid use among women, although opioid prescriptions for pregnant women aren't uncommon, Drug misuse often results from chronic pain that women often face throughout their lives, such as pregnancies, hormones, menopause, and other related symptoms that compels drug misuse. During pregnancy, misusing opioids can increase the risk for several birth defects with the use of prescriptive opioids by women in the month before pregnancy or during the first trimester. After pregnancy, infants who are born to women who use opioids during pregnancy should be monitored by pediatric care for possible neonatal abstinence syndrome, which is a drug withdrawal symptoms that opioid-exposed neonates may experience shortly after birth. In short, opioid use has been found linked to U.S. states with high maternal mortality rates and serves as a major risk for pregnancy-associated deaths. Compared to the social burdens of opioid use, women who start using heroin at a younger age use smaller amounts of heroin over a shorter period of time. Thus, they are more likely to abuse prescription painkillers due to a greater likelihood of experiencing more chronic pain than men. And additionally, sexual relationships with partners who abuse drugs may also put women at more risk than their male counterparts. Furthermore, the insurance status of women also contributes to their likelihood to develop opioid use disorders. According to the National Women's Health Network in 2018, opioid prescription rates are substantially higher among Medicaid patients than among privately insured patients. 40% of Medicaid enrollees with opioid prescriptions have at least one indicator of potentially inappropriate use, and women make up nearly 70% of adults on Medicaid. And this is for individuals who are insured. Financially speaking, many opioid addicts cannot afford their rehabilitation to quit opioid use. And even if they could, many cannot afford the rest of their withdrawal therapy long enough to quit. So unfortunately, they end up relapsing while also becoming poor and impoverished in the process, thus lowering their quality of life.
Hello, I am Juan, and I talk about the opioid impact on population. Individually, the opioid epidemic is growing disproportionately among women. About community, from 1999 through 2016, mortality rates for opioid overdose increased 507% among women, compared to 321% among men, according to the National Institute on Drug Abuse. What is the barriers about opioid? Patient and doctor communication is one barrier. Another one is less participation in treatment programs and no access to healthy habits. Outcomes: 8.4 million ages 18 and older had misuse of prescription drugs in past year. The number of women opioid use disorders and labor and delivery quadrupled from 1999 to 2017. One organization that helps with this problem is Harm Reduction Coalition. Harm Reduction Coalition is a national advocacy and capacity building organization that promotes the health and dignity of individuals and community impacted by drug use. What is the program objectives about this organization? Well, providing overdose prevention, recognition and response education to drug users and their neighbors, friends, families, and service providers who work with them is harm reduction intervention that save lives. What methods are used from this organization? One of the methods used is provide tailored capacity building service to meet the needs of community-based organizations, health departments, and community coalition. What is the results? Our efforts advance harm reduction policies, practices, and programs that address the adverse effects of drug use, including overdose, HIV, hepatitis C, addiction, and incarceration. Another organization that helps with this problem is Action Collaborative Countering the United States Opioid Epidemic. The objectives of this organization are: the Action Collaborative is committed to developing, curating, and disseminating multi-sector solutions designed to reduce opioid misuse and improve outcomes for individuals, families, and communities affected by the opioid crisis. The methods are four corporate areas: health professional, education, and training, pain management, guidelines and evidence standards prevention, treatment and recovery service, and research data and metrics needs. The results and response of this organization are improved coordination and accelerate the pace of change. The National Academy of Medicine has partnered with the Aspen Institute and more than 60 participants across different sectors to form the Action Collaborative and Countering the United States Opioid Epidemic. For more information, you can go to the https://nam.education program/Action Collaborative on countering the United States opioid epidemic. After investigating all this topic about women and opioids, the conclusion has some recommendations in effort to curb the current way to the opioid crisis. The pharmaceutical and medical industry must introduce education and protocols, encourage the safe and judicious prescribing of pain-relieving medications. We think that some treatment for opioid control should not be generalized and consider the sex of the patient, since women are more vulnerable to their consumption. Some suggestions for future directions could be programs that consider the age and physical condition of women who are opioid users, since their consumption varies in age and physical condition. More effective training for health workers who understand age, physical condition, and ethnicity for more effective treatment for women. Thank you very much for your attention.